Hello, my name is Joanna Tseng, and I am presenting to you a PowerPoint on maternal cannabis use and breastfed infants. Maternal cannabis use with breastfeeding is a public health concern due to developmental concerns for the child. The provider is in a key position for screening, counseling, and initiating treatment of pregnant women who use cannabis. Pregnant women are typically highly motivated to modify their behavior to help their child. However, with recent legalization of marijuana in many states, the risk of marijuana exposed in breast milk is a rising concern. Marijuana use and public health concern. Marijuana is a Schedule I drug and considered illegal federally. Therefore, there is not much research done. But research is necessary since this is the most common illegal drug used nationally. States that have legalized marijuana, there are places that sell cookies, brownies, candies that contain THC, which is the active ingredient in marijuana. And since the legalization of recreational use, there has been reports of children accidentally ingesting edibles and needing to visit the emergency room because of poisoning. Edibles affect children differently. An edible cookie may contain as much as 100 milligrams of THC. If edibles are not carefully locked up, children can face serious injuries, and this is a public health concern. For providers to advise patients about marijuana, they need to be prepared and be familiar with marijuana legislation, knowledge of marijuana health effects, and can effectively communicate these research findings to the patients. Interestingly, not a single provider noted that they received any marijuana health education from medical or clinical training in the state of Colorado. And this is a big problem considering marijuana is now medically and recreationally legal in many states. The provider knowledge of state laws. The four key state provisions are the legal age of purchase is 21 years of age, and marijuana cannot be consumed outdoors. Marijuana cannot be carried outside of state. It can be charged for driving under the influence. And less than 66% of providers correctly identified all the four key provisions surrounding marijuana use. So more education is needed. Patient counseling for maternal marijuana use. Women who are breastfeeding should be screened by their providers for any drug use, so the assessment of maternal cannabis use is necessary. They could be incorporated during the early stages of pregnancy or when first planning for pregnancy, since marijuana is the most widely used illegal drug nationally. Providers should address the potential risks using current evidence-based information. The effects of maternal use during lactation. Studies found maternal inability to care for infants while under the influence, and let's see, for pediatric risk of maternal use, for children under 3 years of age, cannabis intoxication includes neurological impairments such as drowsiness, lethargy, or coma. And the risk of addiction, according to CDC, About 10% of marijuana users will become addicted. Until further studies are done, marijuana use should be avoided by nursing mothers because it may impair their judgment with childcare abilities, and THC may be transferred to the infant, which may cause serious harm. Marijuana screening allows for proper education and communication between provider and patient to prevent any undesirable outcome. Thank you.